Welcome back, everybody, to another episode of Outside the Box. I'm with my good friend, Ernie Dickson, physical therapist at Elite Physical Performance. Ernie, how's it going today?
It's doing great. I'm glad to be here.
I'm so glad you're on the show. We've been talking about a few topics that, for one, on the Common Sense MD, I think this past week we talked about stability and, the importance of having a strong core in terms of just as we aging gracefully.
Right, sure.
And this kind of touches on this. You want to talk a little bit about peroneal tendonitis.
Right.
So for the people out there who might be experiencing peroneal tendonitis but not sure that that's what it is, what is it in layman's terms?
Okay. It's on the outside of the fibula or the outside of the lower leg. You have a group of muscles called the peroneals, and there's really two main muscle groups. It's the peroneal longus and the peroneal brevis. And on the model, I've got the model of the foot. I don't know if you can see that, but the peroneal muscles come off the lateral side of the fibula up here about mid-calf, and they come down and they come around the fibula here, and the brevis inserts on this on this fifth metatarsal. The longus comes underneath, and it goes all the way to the big toe. And it's a lateral stabilizer of the foot ankle. And they also help us on push off. And non-weight bearing, they help point the foot down and point the foot out into eversion. But when we're standing on it, when we're weight bearing, it acts more of a lateral stabilizer of the foot ankle. So a lot of times the tendonitis is kind of an overuse of that muscle. So sometimes you'll see someone, they'll have a little ankle sprain, or they have a history of ankle sprains, and say they start running and walking, then they start to have some pain in that outside of the ankle there, and it's usually where that tendon comes around the fibula down here at the bottom, where it makes that little junction right there. So
is that caused by walking incorrectly, maybe, like in terms of like your push off, because I've actually done a little bit of research in terms of like how to push off in the best way.
Right.
Could it be could there be something wrong in your gait that would cause tendonitis like that?
Sure. So a lot of times it has a biomechanical component to it. Of course, those muscles, a lot of times if they're tight, that shortens up the tendon, so you get friction there at the fibula where it goes around that area. Sometimes you can have a weak muscle group there too, and because they stabilize, and say you're doing some hiking or you're doing some running, you're just starting, and you just don't have the strength there. When they fatigue, then the muscle tightens up. It kind of goes into a little bit of a spasm, and that pulls, and then you get that friction there at the fibula. Kind of the other thing that can happen if you have a history of ankle sprains, the ligaments, when you sprain your ankle on the outside, those ligaments, they heal, but they're never quite as strong as they were before. So you have to have extra good strength in those peroneal muscles. And two, if you're walking, say you're walking on the roadway, and the camber of the road is sort of cambered off on one side, well, that makes you sort of roll to that side. So a lot of times that will cause it. So if you're, say if you're walking against traffic, and that side that is down tends to get overused because it kind of throws it out of neutral position. Or if a person is a little bit bow-legged, it's called a varus of the knee, then that makes that fibula kind of come down at a different angle, and then that causes those tendons to have some friction when they come around there.
So is there any sort of preventative measure people can take, because the situations you're describing seem like everyday situations, things that we might not have a lot of control over. Is, I know you're a big proponent of, rolling out your feet, or, rolling on the foam roller. Well, is there anything we can do in order to deal with this sort of tendonitis?
Sure. On a day-to-day basis, really, if someone is doing a stretching exercise program, that usually helps. A lot of times, people will stretch their calf muscles, the gastrocsoleus in the back, and that's really good. That sort of stretches out the Achilles tendon and the calf muscles. But that lateral muscle, those peroneals on the side, a lot of times, most people don't really stretch those. So if you can stretch those, that just kind of helps prevent that from happening, because you like to have that flexibility in that muscle group. And the other thing, if you have a little bit of history of, say, ankle sprains, or say you've, if you tend to supinate, which means the heel itself tends to want to come in a little bit, then that kind of predisposes you a little bit to peroneal tendonitis. So if you have that type of foot or that type of biomechanics, it's a good idea to do some strengthening for those foot everters.
So how do you strengthen your foot the foot everter? Is that like a, some sort of ankle strength
Right.
exercises?
There's several ways to do it. If you're injured or you have tendonitis, you don't want to overload it, because then you can make it worse. But an easy way to do it is do isometric. So you're trying to sort of turn the sole of your foot outward. So on the model here, you'd be trying to turn the foot out this way, and of course you just kind of push it against the wall there, and you hold that.
So you want. So if that's I'm going up a little bit.
It's sort of like you're turning the foot out, and then you apply force against that. So you're pushing out against it.
Okay.
And you hold it maybe 6 seconds. And you could use some therotubing. So you could put a little piece of therotubing on the wall, and then put your foot ankle in there, kind of put the tubing right here, and then work against the tubing this way to strengthen those peroneals. The other way, which is functional, is to actually do some standing, some static strengthening, because that's how you use the muscle when you're walking and running. But you're going to stand on one leg there. You can use your hands to balance a little bit, and maybe do a partial squat, and you're trying to keep your balance, because that foot will want to kind of evert back and forth, and those the peroneal muscles help stabilize it, and that's a real good functional exercise.
So are the peroneal muscles a part of the foot, or are they a part of the fibula?
They're part of the lower leg, like the lateral part. So if you can imagine the fibula here, this is the outer bone on the outside of the lower leg. This goes all the way up to your knee.
Okay.
So you have a joint here on the fibula. It's called the inferior tib-fib joint. You also have a joint up at the knee called the superior tib-fib joint. So those joints sometimes get stiff in there, and that's another component, is you can mobilize that. It's something you probably need to go see a physical therapist to kind of help you do it properly, but they can show you how to mobilize it yourself, because a lot of times this gets a little stiff, and if you don't get the normal motion there, then the tendon rubs over that little bony area. So that's another component. It's called joint mobilization. You can do the soft tissue stretches, but sometimes you need the joint mobilization to go with it.
How would you test for that? So if someone were to come in and they're pretty sure they have some sort of tendonitis, and
right.
And if it's on the outside
Sure.
of the leg, it's probably a peroneal
Right.
tendonitis. How would you test for it? Is there like sort of strength test you do?
Sure. Or it's kind of like an overall. The first part you would just look and kind of palpate that tendon, like palpate it from the origin up here in the lateral calf, and go all the way down and see if it's tender on the insertions there. Then you'd have them do active motion and see which motions hurt. Usually, if it's the peroneal, it's going to hurt when you point the foot down and point the foot out. So that tells you there, okay, that's probably the peroneal. Now, if you kind of pointed down and it hurt in the back, that'd be more of the gastroc-soleus or the Achilles tendon. So,
would people confuse an Achilles injury with this? Like, do they kind of? They're in very similar spots.
Yeah, sometimes they do, because the peroneal sometimes will hurt on this lateral border.
Yeah.
Sometimes it'll hurt right in here where it comes around the junction there, and you'll have that diffuse pain in there. And so you can kind of tell by just palpating the like the Achilles tendon, but also doing the manual muscle testing. So, if you test those everters, because the Achilles doesn't do anything for the eversion of the foot.
Okay.
So you can kind of see by doing the active range of motion and doing the strength testing, and then you can do the special test to see where you actually do some mobilization on that to see if that causes any problems.
What sort of, have you noticed any sort of commonality between people who are coming in for this sort of thing to see you? Is it are they runners, heavy runners, or do they also have knee problems? Is there any sort of like consistent thing you're seeing with a patient who is struggling with peroneal tendonitis?
it seems like the ones I see, they usually have a history of some problems before. Say they're starting a walking program, running program, and they start off, and then they're doing pretty good, and all of a sudden they start having problems. They start having some pain, but a lot of times it goes back to the biomechanics a little bit. It's like if they've got a little, like a little bit of varus at the knee, and they've got a little supination of this rear foot. That sort of sets them up to have a tendency to have it more frequent.
What do those two words mean? The varus and the supination?
The varus means it's kind of an outward bowing. Like if you've ever seen one, like if you've seen somebody that's bow-legged,
yep,
that's called varus.
Okay.
So you have a bowing out, and of course the fibula up here, that changes the angle up here when you have that, and that changes the angle on the pull down here.
Okay.
The same thing in supination. You've heard of pronation. Pronation is when we roll too far to the inside. Supination is when we're rolling this way. Some people, if you see them standing, it looks like they're kind of standing on the outside of their foot.
Yep.
Those folks are supinators. So the people that supinate, they're a little bit more predisposed to have the peroneal tendonitis.
Is that have anything to do with walking pigeon-toed?
No, it's kind of different. Usually that kind of could be more coming from the hip or from the lower leg just turned in, but the supination occurs here at the subtalar joint right in there.
Interesting.
In there, that's more where the supination part of it comes in.
How, I'm kind of a big believer in you need strong feet.
Yeah.
And I feel like we're talking about very small muscles here.
Sure.
And small bones. How do you coach people to strengthen up their feet, out of curiosity?
Yeah. It's kind of like you have to isolate those muscles, and it seems kind of, at first it seems kind of silly, but you've got the intrinsic muscles in the feet, like the toe flexors and the toe extensors, and then you've got the muscles that tend to stabilize this inner arch in here. You've got the plantar fascia in here. So all of those things give that foot support, because if you think about the bones in the foot are all pretty small compared to our other bones. Like our femur is a big, long bone. Mm-hmm. Our tibia is a long bone. But our feet, they absorb all the shock, and they're all small bones. So the muscles, the intrinsic muscles, and the muscles that go around the foot ankle have to be pretty strong, and plus they have to be pretty pliable, because you've got the foot's got to be able to pronate enough to push off of, and so that foot has to be stable enough, but it also has to be flexible. So it's kind of a balancing point. And then if you're a little bit one way or the other, it kind of predisposes you to have some of those issues, some of those overuse.
Yeah, it's so fun. It's so funny. Like I feel like it's hard to picture what a foot exercise would be. Other than I know walking barefoot is a decent one. I know there's I guess toe raises and maybe what do you call it when you're kind of strengthening your calves?
Right.
I guess
or
it's
like you're doing toe raises. Yeah. As far as the peroneals, probably the thing to stretch them, it's almost the same position as you're doing a calf stretches for the Achilles, but what you're doing is you're inverting the foot. You're turning the foot in, and then you're leaning forward and you're bending the knee, and you're trying to isolate the stretch. You'll usually feel a stretch right in this area, right in here. So that's the way you can stretch them. But now if it's kind of flared up, if you overstretch it, you can kind of get into trouble with it. So you don't want to overstretch it. You can, if it's really irritated, it's better to stretch it non-weight bearing, because sometimes the weight bearing is just too much stress on it. But the exercises for it really like doing some standing, some static dynamic type of strengthening, where you're trying to balance on that foot. Then you're trying to do some head turns. Even close your eyes. Try to use that. Take away your visual system to challenge those muscles in the foot ankle.
What does that do? The head turn. So when you take away the visual aspect of it, does it? That's got to have some sort of brain component to it.
Sure, it's kind of like our balance. Like our balance is kind of composed of several things. One of the things, like our vision, like if you're standing on one leg and you're looking out and you close your eyes, you'll notice you really have a lot more trouble trying to maintain your balance, because the vision tells your brain where your body is in space. So if you lose the vision, it's just like if you get up in the middle of the night and it's dark, you kind of stumble around a little bit because you don't have the visual to give you the cues to balance yourself. So
interesting.
So it's the same thing. With the foot ankle, like the balance part of it, there's proprioceptors in your foot ankle that tells your brain where your foot is. So a lot of times people that have the tendonitis, they don't have good proprioception. So as you kind of progress their strengthening, you have them standing on that foot, and then you can sort of add head turns. When you turn your head, that changes. Your eyes are moving, so you've got to make up. I mean, your foot's got to stabilize itself. But if you ever try it, just try standing on one leg, look out, and then turn your head. You'll notice you have to really use your balance a lot more. You'll feel those muscles in your foot ankle kick in.
Oh, so what that does is it throws you off balance, and because it throws you off balance, you have to activate those muscles in your proprioceptors,
The peroneals.
in the peroneals, and really almost, I think of it like really ground.
Well, I think it challenges your vestibular system, like your equilibrium, because your inner ear, that's where and your cerebellum and the brain, those things all are kind of interconnected as far as your balance. So, your foot's telling your brain where your body is in space. So when you're moving your head and your eyes, your vision's changing. So you're having to kind of, your body's trying to stabilize yourself. It's more of a challenge for it. So you can incorporate, that in your exercises. You can start to do head turns. You can do, close your eyes and do head turns. That's even really hard. But, have something stable that you can support yourself. But you're working on your balance and your equilibrium, but you're also working on the strengthening part. And the foot ankle, that's a big, that's a big proponent, because when you're running, you're not really looking down at your feet. You're expecting your foot to hit the ground, and your foot sort of senses if the ground's even or not. It's just like if you walk across a yard at night and you can't see the yard and it's real lumpy, it's easy to turn your ankle just because you don't, and part of it's because you don't have the vision to see that it's lumpy. And then the other thing, it's, your foot rolls before you know it's rolling out there. But that's the proprioception. There's little joint receptors in there, but those joint receptors kind of interact with the central nervous system, and then the muscles are kind of tied in on that. So you can kind of incorporate them both.
That's really interesting. Is there any exercises you yourself are doing to help with kind of that foot ankle strength, adding in the proprioception?
Yeah, a lot of times I will do some things like, if I'm just sitting in a chair, you can do isometrics. That way nobody even knows you're doing them. You can sit there and just put your other foot, I don't know if you can see on the camera, but I'm just crossing here and I'm pushing into my foot like that. But so it's an isometric. You're not really getting any movement. You're trying to push your foot into, more like the wall or something that's immobile. And then you can get some therotubing and just tie it around a table leg and sit there and do some eversion strengthening, where you're turning the sole of the foot out with the resistance. But the most functional thing is actually just do some one leg standing, and stand up good and tall, and you can do maybe a partial squat. See if you can maintain your balance, and you'll feel your foot ankle really work. But those peroneals, you'll feel that foot really trying to stabilize itself.
Now, I don't want you to lie to the audience, because I've seen you do this. You don't do it on the ground. You do the one-legged on the half Bosu balls.
Yeah. And actually, see, if you add some foam on there, it makes it more unstable. Or just put a pillow on the floor and do it. And that really makes you use those peroneals.
A pillow? I haven't thought about that.
Yeah, the pillow is really practical. You can do that, and it's amazing how much you use those peroneals on that.
How far down are you going in this one-legged squat?
Just a partial, maybe about 25, 30 degrees. You don't have to go real deep.
Okay.
And the thing is, when you start, have something you can hang on to that's stable, like a table or something that's not going to roll on you. But really, you can do those, and it sounds easy. It sounds too easy, but when you do them, you'll notice it's pretty tough.
And I will say, guys, if you do this, make sure you do have something to hold on to.
Yeah, you don't want to fall.
You don't want to fall. But
and the other thing too, if you really have tendonitis that's fairly flared up, you don't really want to be doing those things right off the bat. You want to be icing it, trying to get it under control. The other thing you can do, if it's really bothering you in those early stages, of course, ice is kind of the thing that really helps. You can do that 3 or 4 times a day, because it acts as an anti-inflammatory. But you can also use some KT tape The KT tape really helps with the proprioception part of it and helps those muscles fire. You can do some soft tissue. You can do some trigger point releases up in the peroneal muscle, and that keeps that muscle from spasming in there and drawing up tighter. You can even do some dry needling. I do dry needling in that area, and what you're doing is dry needling trigger point areas, and that relaxes that muscle, and it takes the tension off the tendon where it inserts. So you can do a little bit of everything, but the key to it, though, is getting it early, because if you let it go for months and months and months, sometimes you get a tendinopathy, and that's different than tendonitis.
I have to ask you, what's the difference? Because what is a tendinopathy? I've never heard that.
Or it's like, when you first start having some issues, the tendon is inflamed, and that's tendonitis. But say you've had tendonitis for 6 months, and you run on it or walk on it, and it flares up, and it gets a little better, and you ice it, and you go back out, and it flares up again. Well, every time it flares up a little bit, your body is trying to heal that area, so you get a little bit of scarring in there. So the blood flow to that tendon sort of gets compromised over time. So that tendon starts to be, it doesn't really heal itself because you're not getting the blood flow in there because it's been a chronic tendonitis. Now the tendon starts to degenerate, and that's not good because then the tendon, it's not healing itself. It's actually getting worse. But it's usually when you've had chronic tendonitis for a long time and didn't treat it, then you get a tendinopathy, and that takes a lot longer, and a lot of times, that's a tough thing to get through. So the key is, when you first get some early treatment, and just, come in and see a PT, and we can evaluate you and get you started. But a lot of times people will wait a year or something. They'll say, well, I've had this for a year, and it just keeps coming back and forth, and they finally come in, but then, they've had some scar tissue laid down, and that blood flow to the tendon is not real good, and it's actually trying to degenerate a little bit. So that's what a tendinopathy.
That's super fascinating, and I think that's part of the purpose of this episode here is just to let everybody know what peroneal tendonitis is, so that if you have pain like that, you can start to work on that and not let it get to a tendinopathy situation. So Ernie, I appreciate you explaining this and talking us through peroneal tendonitis.
I hope that helped. It's kind of a tough thing to explain sometimes. I hope I explained it.
You did.
Where it wasn't too.
It was perfect. It was perfect. And I really do appreciate it, and I love this model. Guys, if you watched it on YouTube, you got a ton of value out of that, watching the Ernie with the foot model here. If you're on the podcast, check out the YouTube of this video. But Ernie, man, I appreciate you coming on the show.
Thanks so much, man. I enjoyed it. Thank you so much.
Guys, as always, thank y'all for hanging out with us today. I've been with Ernie Dickson he's been explaining peroneal tendonitis. I'm your host, Ben Rogers. As always, we'll see you guys next time.
Don't go away.